It's being called one of our least recognized health threats. It's giant cell arteritis, and I'm joined now by someone who can teach us a thing or two about this condition. Dr. Stephanie Garner, good morning.
Thank you. How are you today?
I am great. Thank you for coming on. It sounds menacing. Giant cell arteritis. Tell us a little bit about this. It's often overlooked, but it's still pretty significant.
Yeah, so giant cell arteritis is an autoimmune condition, which means your body's attacking yourself. That occurs in patients over the age of 50, and it often presents with a sudden onset headache that lasts more than 24 hours. It's not going away with over-the-counter medications like Tylenol or Advil. And it's often associated with vision loss or jaw pain, and patients can present with complete vision loss or stroke to emergency departments. And it often grumbles with, it's really common to have a headache, and obviously not everyone with a headache is giant cell arteritis, but it can be missed because, as I said, headaches are common. And when patients come in, the vision loss often gets attributed to stroke or other causes. So it's really important that we recognize this because we've got to get treatment on board really quickly to prevent further vision loss or stroke.
Okay, so who is being affected by this then, GCA?
So typically it's people over the age of 50. So if you're under the age of 50, you do not have giant cell arteritis. It's over the age of 50. And generally speaking, as you get older, your risk goes up. So we see more giant cell arteritis in patients who are in their 70s and 80s. And it's often completely out of the blue. It's not triggered by anything that we know of yet. Patients will present, sort of, as I said, with vision loss or a new headache.
So how common is this? I suspect it's probably more common than we know, right?
Yeah, so we're not great on having estimates, particularly here in Canada. So we learn a lot of our data around how many patients are affected from other countries, but it's probably about 100 patients per 100,000. So here in Western Canada, that does, we do have a large population that does affect quite a fair number of patients. And when we're on call, I'm in Calgary based. When I'm on call covering a catchment area about 2.5 million, we'll get several phone calls a week for this condition. Okay.
Now, I know there was a clinical trial here in Saskatoon. What did you learn from that, or what were you hoping to learn?
So we're always trying to figure out how to get away from prednisone. So in rheumatology, we use a lot of prednisone. It works really well for this condition, but it causes a host of side effects: high blood pressure, diabetes, weight gain. Nobody likes weight gain. Difficulty sleeping, thin bones, which means you fracture easily. So we now have some newer medications. So we have tocilizumab, and the recent clinical trials showed that upadacitinib, which is an oral medication you take once a day, can allow us to get rid of the prednisone. So patients get exposed to a lot less steroids and are able to stay in remission, which is our goal for us in rheumatology.
Okay, so Saskatchewan seniors then, what advice do you have for them when it comes to giant cell arteritis?
So I would say anyone with a new onset headache over the age of 50 that lasts more than 24 hours and is not going away with over-the-counter medications should get assessed by their family physician. That would be standard of care. There's a lot of things that can cause a headache. Giant cell arteritis is just one type, but there's things to be concerned about. And we do a blood test for GCA. It's a blood test looking for inflammatory markers. And when they're elevated, that's when we consider it. And obviously, any sudden onset vision loss, you should attend your nearest emergency department.
Okay. Where can we go if we'd like a little bit more information?
Yeah, so the Vasculitis Foundation has some really great resources. It's a patient foundation here in Canada. And then the Alberta Provincial Pathways Unit has developed a pathway for giant cell arteritis, and that's available on their website also.
All right. Giant cell arteritis, Dr. Stephanie Garner, thank you for a few minutes this morning.
Thank you for having me.